Thanks so much. All right. Thank you all so much for being here. It's a busy time of the year. It's close to a Friday. I really appreciate your time. So I am going to present on two big things. They are related. I'm going to couch this under the framework of right to cool, but ultimately about transforming protection for priority populations from extreme temperatures. And I'd like to acknowledge that the research informing this presentation took place on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, as well as the Katsik, Coquitlam, and Kwantlen, and Tsawwassen First Nations. So here's what I have in store for today. So first, I'm going to start with the context and my approach to the issue. I think that will help contextualize the whole presentation. And I have this divvied up into two parts. So in the first part, I'm going to talk about improving extreme temperature center access and experience. So the bulk of the project that informs this presentation. And for that, I'll give a brief overview of the project and present main findings that we heard from service users, both housed and unhoused, and also service providers. And then I also have some so what / sticky points, what I'm calling. And these are the less tangible, less straightforward issues that have come up. And the second part is to contextualize all this in the framework of right to cool. And I'll talk more about this as we go on. And I think it will become clear to you as we go what I am trying to do. But in the end, my hope for the presentation is that you walk away with one, some actionable recommendations for your team if you're directly involved with these services. Second, also walk away with some thoughts about how cooling centers configures in the broader movement of right to cool. And third, thoughts about how right to cool can advance more equitable and just and healthier communities more broadly. And so, you can gather from this that I'll be touching on points much broader than just extreme temperature centers alone. And I'm going to go back and forth between using the term extreme temperature centers and cooling centers, warming centers. I will note that most of the interviews talked about cooling centers, so that will be a prominent focus, but there will sometimes be mentions of warming centers as well. So while I get going in the intro, I'm going to put this here so all of you can fill this out on your own time between now and the second part, so you have some time. And I have this strewn throughout the slides towards the end as well. But for now, if you can go on Menti and enter the code or take this QR code, that'd be great. I won't do this activity now, but I will give it to you now so you have some time. So the question is, what initiatives, programs, or ideas come to your mind when you hear right to cool? And if you've never heard of it, that's a great answer too. All right. So first, let me set the scene. So, you all know this here. Heat, extreme heat events, and general heat is increasing in intensity, frequency, and duration. And there are many, many resources available, but they are, at least in Metro Vancouver, underutilized. That means that seniors and others facing marginalization and injustices are, they are already disproportionately impacted, but all the more so when these services are less accessible or they lead to negative experiences. And at the same time, recognizing all these challenges, there are different right to cool initiatives and movement and mobilization popping up. I am going to show this little video that gives texture to all of this. So it's actually one of our participants who agreed to be on video. It's for a separate but related project that, she tells it in her own voice what living through extreme temperatures is like in subsidized housing. So let me just switch this mode of sharing. Can everyone see my video? Yeah, great.
我係楊女士，我住咗呢棟柏文係19年，好開心。喺中國廣州長大嘅，40歲嚟Manitoba 溫尼平，因為我嘅家人搬落嚟溫哥華，所以我哋就拉我媽咪一齊搬落嚟，97年搬落嚟嘅。
And this is Vancouver, a city baking yet again tonight in a record-smashing heat wave, one that's being called not just historic, but dangerous.
719 people died suddenly. The wait time for an ambulance, hours. Paramedics overworked. But whose fault is it when someone dies of extreme heat?
熱就肯定會有少少困難㗎啦，因為你太熱，又開埋風扇都熱，咁就即係都想外出咯。但係年紀太大嗰啲老人家佢就出唔到㗎啦，因為太遠啦，咁佢哋推住嗰啲車啊咁樣咯，即係都應該係好困難㗎啦。好熱嘅時候咧，咁佢哋因為下低嗰個冷氣電視房嘅冷氣係20小時開放咯，咁樣就有啲好似601嘅鄰居咧，佢哋到凌晨1點佢先上翻嚟咯。608嗰個鄰居咧，佢就喺度瞓覺咯。咁仲有506有個鄰居咧，佢係帶住氧氣筒，佢都成日落去咯。嗰個天氣如果嚴重咧，如果氣管咧會影響個肺，拉埋個氣管，即係你太熱，即係唞唔到氣質，即係好喘氣咯。即係要經常做嗰個深呼吸，即係做深呼吸嚟緩和嗰個肺啦，埋個氣管嗰個咯。仲要咧，如果太熱咧，會有出嗰個皮膚啊，即係嗰個疹啊。即係嗰啲會有起濕疹啊嗰啲咁咯，有啲咧仲即係因為熱得滯，佢會暈咯，太熱嘅沖多2次涼啊咁，但係即係會頭暈啊咁樣咯，即係唞唔到氣啊咁樣咯，會出街。如果冇冷氣，佢哋全部就喺呢邊嘅人咧就落晒去坐喺個即係大堂啊電視房嗰度，即係就都叫做陰涼少少，因為太陽係曬到入呢邊曬到入屋嘅，即係好多人都走喺下低坐嘅。
All right. Hope people can see my presentation again. So big thanks to Abby Zhao, one of the students I work with who helped translate and interview Ms. Yang for this video. So as Ms. Yang says here, you get the sense that it's not just temperatures and humidity that's the issue. There are mobility challenges that hinder people's access to cooling centers, or even just, going downstairs, say building maintenance wasn't up to par and the elevator doesn't work. I mean, there are instances of people who have died in staircases during the 2021 heat dome because their elevator was out. So this is, I just want to set the scene and say this is a much broader issue than just temperature alone. So with that, I also wanted to start off by saying that to state my positionality. So I am not a climatologist or an engineer or a health practitioner. I'm a social scientist trained in sociocultural kinesiology, which means that I think about bodies in social, political, and cultural contexts. So bodies not just as biological systems, but also as mirrors that reflect social patterns and disparities. which leads me to focus on social and environmental determinants of health. So this allows me to think about why some bodies or people may be considered or treated as dispensable or less valuable, and hence render to higher environmental pollution and climate-related risks. So I'm approaching this question of different levels of risk and protection around extreme temperatures from a social inequities angle, first and foremost. And overall, I'm interested in finding opportunity in the overwhelming complexity of climate change, where addressing the climate crisis can also mean undoing and rebuilding our society so that everyone can live with good health and dignity. So that means a world where everyone has secure and adequate housing, where no one is isolated or forgotten, and where poverty does not dictate whether you survive the next heat wave or wildfire smoke or a cold snap. So with that, let's start part 1 here, focused on extreme temperature centers. So while the project addressed both cooling and warming centers, again, the focus on cooling centers was more prominent, so you'll see that reflected in this presentation. And the overall objectives of the project was first to improve access to and uptake of existing services and resources, and second, to seek creative and transformative alternatives that can protect people at highest risk from extreme temperatures. So a brief overview of the project. So just a bunch of detail that will just be included in this slide, so you can look at this afterwards. But what this really conveys is that this was a massive team effort. And of course, there are community partners involved who I listed on a different slide, so I can acknowledge them separately. But big thanks to my UBC project team and the team of wonderful student RAs, research assistants who carried this out on the ground, and also to the funders, CIHR and the Pacific Institute for Climate Solutions. So our project recognizes that cooling centers are not the perfect nor a sustainable solution to the increasingly severe and frequent extreme temperatures that we're seeing. Of course, in an ideal world, everyone should be comfortable in their own homes and, was housed in the first place. But that's not the reality we're working with, and people are dying now, which is why we're focusing on improving access and having better experiences in these facilities and services. So what do we already know? So our team is certainly not the first to tackle this issue. There have, of course, been many responses. Many response plans already exist, and I'm sure probably some of you have devised some of these. So you've seen warming centers, cooling centers, as well as efforts to leverage existing facilities and resources like public libraries, swimming pools, and city parks. However, despite these efforts, research suggests that these services in BC are underutilized, and we also do not thoroughly understand their overall efficacy. There are some qualitative analyses of user experiences of these services, but they're mostly based out of Canada. There's a lot based in Australia. There are a few studies based in Canada, such as a survey with service providers following the 2021 heat dome, which found that perceived barriers to cooling centers include lack of awareness, inability to bring a pet, stigma, distrust of authority, and lack of staff training. So to fill this gap, what did we do? We first had a consultation with community partners even before we started, applying for the grant. And the service users, our community partners included these community organizations. So on the service user side, South Vancouver Neighborhood House, South Vancouver Seniors Network, Yarrow Intergenerational Society for Justice, which is based in Chinatown and serves mainly Chinese seniors. Elizabeth Fry Society in Metro Vancouver, so not just limited to Vancouver, and Engaged Communities Canada Society, who really helped us connect with unhoused individuals. And then service providers, so from New West, Port Moody, White Rock, Richmond, again, also in Surrey through Elizabeth Fry. So after consultation, we knew that our project team knew that this was an issue, and we also wanted to consult with community partners to see what their needs are. And then we applied for the grant together, thankfully got the funding. And then we refined interview questions with the partners, collected data through interviews and focus groups, and that was 60 service users and 9 service providers. So a much heavier emphasis on the service users. And this happened from last October to this February. And when I say service users, this means people who have used them, use these facilities, and also potential users. So people who could use them, but have either not because they couldn't or they chose not to. And there was also various levels of vulnerability. So, some people were, as I said, unhoused, some people were precariously housed. And yeah, so there were various levels. And we did, I think one of the strengths of this project is that this was multilingual. So we know that not just in, this type of project, but language barriers are a huge obstacle for equitable participation in these studies. So and also recognizing that a lot of these marginalized populations who are impacted by these temperatures are primarily non-English speaking or non-dominant English speaking. So we offered interviews in Cantonese, English, Farsi, Mandarin, Spanish, and Vietnamese, again, thanks to the brilliant student research assistants that I work with. And then we did data analysis, and we didn't stop there. So part of this included community peer review. So, as a team, we conducted our own process, but then we went back to these community partners and also the participants to say, do these findings resonate with you? Is anything missing? And finally, this is culminating in a knowledge exchange event tomorrow. And I'll say a little bit more about this now. Yeah, so tomorrow we're going to gather participants, research participants, as well as knowledge users and different stakeholders to report findings from, focused on extreme temperature centers alone, but also couch this in under the broader umbrella of right to cool, which is what I'm doing here. All right, so on to the findings. I've divvied this up to house service users and then unhoused service users, and then I'll go to service providers. So for housed service users, we saw 3 kinds of barriers presented. So first was external infrastructure related, and then operational details, and then concerns and perceptions, which were less tangible, which I called sticky points earlier on. So let's start with infrastructural problems. So transportation and mobility issues were really, really prominent. So one person here emphasized the unpredictability of buses and the challenge of waiting for them outside while it's hot. And many felt that there were not enough facilities around them. Either, we don't know whether they are available and they didn't know, or there aren't any. This is something that we need to find out more as we do the write-up. And operational details also came up again and again. So for one, many felt that there was a lack of specific info about the location and the purpose of these places. So now I think many service providers on the call here may feel defensive, and I think you're justified to feel that way because, at least in Vancouver, from what I know, this information abounds if you know where to look for it. So while the participants call this lack of information, I think I would like to add that perhaps it's more of a communication methods issue, and I'll come back to this. And yeah, language barrier was another. Many also felt that there was a lack of activities and not enough socializing opportunities. And this person here said, I go because it's the nearest to my house. I feel very, very safe there, but I can't be standing for 2 hours. So there's a lack of seating, which was a prominent issue. And hours of operation as an obstacle really came up often. So many felt that these centers were not open long enough, especially because evenings are when these participants' apartments were the hottest. And there's a lot of, other studies that show that nighttime temperatures really are the problem. I mean, a big problem. And, they never cooled down enough for people to get a decent night's sleep. So here, this person said, especially in the summertime, places that close at 9 o'clock, that's when the heat hits you. So you've got to have places open. And then lastly, some less tangible concerns and perceptions that are more challenging to address. So many said that they have concerns of safety and hygiene around these places. So consider this quote here. The key factor is ensuring a sense of security. Personally, I've experienced situations where I took one look at the facility and immediately turned away. This person also said, you can't just herd people together in a room and say, there, we can cool you all down. They put me between two people who are coughing like mad and not wearing masks. So there's also concerns of getting sick and hygiene. And also, many people perceived extreme temperature centers associated with unhoused individuals only. And, conveyed in the interview transcripts around this is just a lot of stigma around unhoused people. And also, yeah, and associated perceived threats to danger. And then existing perceptions of government and authority organizations also really matter. So this was also a finding from the Yuma Lugova report that I mentioned earlier, where, yeah, existing distrust of authorities, government organizations led people to hesitate in seeking these places out. So here they all are. But what I want to mention is also that, something we learned at the outset of the project, and we learned this through trial and error. So we first called the study Extreme Temperature Shelter Study because that was the word that we were using. It just became the norm. And then while we were going to different places, both physical and virtual, to recruit people, they told us that the word shelter made them think that the study was only for unhoused folks. So we changed all our recruitment material to say extreme temperature centers or services, and that really did make a difference. So even, what we call it itself was really important in, even just inviting people to talk about this for a paid study. That the stigma associated with the word shelter was that prominent. So you can imagine if a cooling center is called a shelter, that might really make people hesitate. So with all these challenges, we found that many instead used both existing public and private spaces like malls, grocery stores, pools, and parks, rather than explicit warming and cooling centers. And very importantly, many prefer their homes even when it's clearly insufficient. There's also the reality, though, that while cooling centers are really helpful, that's not an option for many. So, people might prefer homes and actively choose to stay, but also others with especially mobility challenges, they're staying because they don't really have an option to leave. So what all this leads to is that, if these familiar places are not convenient to access, many would rather suffer at home. But also many people have really poor indoor environmental quality. And many tenants do not have control over their indoor environments and are subject to their landlord's decisions. And here's a quote that illustrates that point really well. So here's a tenant saying, my neighbor had an argument with our building manager about this. They said there's no solution, the pipes are aging, and they can't do anything for it. The manager even said, if you don't like it, you can leave, find another place to live. So we thought buying a heater ourselves is the only way to solve the problem. So this person's talking about extreme cold. But you can see here how this rings true, especially in a context like Vancouver, where housing shortage is very much real. And also, in other major cities of Canada as well. So you can see here the intersections of the housing crisis and the climate crisis, which will become more and more prominent as we go on. Now on to findings from unhoused service users. So these were some of the main points here. So lack of space, and then finding public spaces as hostile spaces. And there were a lot of points around this. So, some people said, I don't have anything more to say, except we just need more spaces and places where we are welcome. And marginalization, relatedly, is written upon their bodies. It is legible in what people wear, how they present themselves in public spaces, and that leads to people being expelled from places and feeling unwelcome. And again, on a related note, because of intense gentrification of certain areas and social cleansing that goes with it, there are fewer and fewer places, even outdoors, for people to seek refuge. And some people here, so this yellow quote here, they said they found staff to be kind of rude, and they didn't like the fact that they had to leave their belongings outside. And this green point here, so this kept on coming up, and you'll see the service providers also mention this. A lot of people, a lot of unhoused service users, when they sought out these shelters, they also wanted more support. So things like job training, mental health support, in addition to just shelter and food. To give more texture to these findings, here are some extended quotes from some unhoused service users. So this is Salim, and he is a 45-year-old man from Afghanistan. I will let all of you just take a moment to read. So he's pointing out providing transportation services as something that would be helpful. But he does sometimes prefer to just stay outside rather than a shelter. Yes, and thank you, Laura. Not always aware of the location and transportation. I didn't know you could do that on Zoom. That's really cool. Thank you. Next one. Travis. So Travis is a 50-year-old man, a First Nations man from Haida Nation. So I'll let you read here again. This is a poignant one because, you know, he says that he gets racism thrown at him a lot, but he doesn't care because ultimately he just needs safety, and that trumps the discrimination. That is not an ideal reality that anyone should have to live with. But also, as Salim also noted, cold seemed to be a lot more of an issue than heat for unhoused folks. And Travis was also hoping for some privacy within these shelters as well. And of course, more spaces and places where unhoused people can feel welcome. And lastly, Mahmoud is a 71-year-old man from Iran, and I will let you read here. So this one's pretty heavy in many ways. So you can, you know, in the beginning when he mentions the crutches and you know, he got them because the cold made him fall and he hurt his hip, you can see how the vulnerabilities start compounding and accumulating. But he did find out about the shelters from other homeless folks. And he does, you know, he does usually use them and he finds them overall positive, but he does want more services. And that said, I also understand from the service provider's perspective that you can't do everything. So there's a mismatch in, you know, what's wanted and what can be provided realistically. And again, the mobility challenge keeps coming up, you know, for someone like him who is on crutches all the time, he needs help moving. The last point here, I hesitated. I thought a lot about whether to include or not, because it doesn't, you know, I didn't include this here to say our project did such a service, but I think it says a lot about how people feel, whether they feel heard or even cared for. And I think that goes a long way in whether someone feels welcome in a space or not. So I decided to include it after all. And you see the Engaged Communities Canada Society's logo here. That's because they conducted these interviews for us. And a big thank you again to them. So now on to service providers. So staff found, we can start with challenges. What they found really challenging was the uncertainty surrounding when the services will or should be operational. So this translates to challenges in presenting to the potential users about when things will be available. And also there's massive differences across different places. So, you know, as you saw, there's different libraries, community centers, they all have different operating hours. So it's difficult for service users to keep track of what's open, when, how long. Also, there were numerous challenges with staffing. So particularly for locations that are also in other municipal buildings like libraries. And we were also told that, you know, a lot of staff aren't notified until pretty last minute that they need to stay longer hours because they need to operate as a cooling center that day. Other challenges included contending with individuals who were rude, aggressive, or discriminatory against staff. And also they found it challenging to not be able to meet broader social determinants of health needs of users that are demanded. So just like what Mahmoud just mentioned, about finding transitional housing and job support. So this service provider said there are limitations as to the services we can provide at our site, and we can't always fulfill or meet the needs of our guests. Things like securing stable and affordable housing, or even securing ID. So there's a lot on the service providers. And other aspects. So for needs, we found that service providers would like larger sites with shower and laundry services, more storage area. So as you saw in the beginning of the unhoused service users, they want to bring their belongings in, and that's only possible if there's more space. A place to smoke and use substances where it's safe and supervised, or have a safe consumption site nearby. Having more health and social workers available on site, and also legal aid or other legal services to meet other demands. I do want to point out this point here, the need for safe consumption sites nearby, or just an open environment where people can use substances. I agree. I think this is a really important point, but you can also see here how this becomes a challenge for some potential service users. As you saw, they mentioned that a lot of them hesitate to go because they don't want to be around substance use. So here, these are the points I think that make it really challenging to meet everyone's needs. And then barriers. So there's lack of awareness of these accommodations around belongings and pets. So what they're saying here is that they've actually made accommodations for people to bring in their belongings and their pets, but actually people don't know it. So, they just, service users will just conclude that's not possible and hesitate to come. Sharing a space with individuals who don't get along or who use substances is a challenge. Sharing washrooms, having pets within the shelter when other people don't want them. Again, it's just, I think overall what all of this conveys is that it's just impossible to meet everyone's needs exactly. But some successes, so more low-tech communication, so sandwich boards, word of mouth, people going around, volunteers telling people, has been a lot more effective than posting on social media. And opportunity for regular meals, socialization, rest, and sleep. So I guess what this gets at is treating the whole person rather than just the person as someone seeking lower temperatures or warmer temperatures for cold, accommodating pets, and supporting people with disabilities or other mobility challenges, and also to be able to use their medical equipment. Multilingual accommodations, and again, the ability to refer people to other services that are necessary. And many people found, especially for supporting people who are unhoused, the ability to speak openly about and use substances. So here are some improvements that were suggested by the participants. And I'll just point out here, the mentee here is back. So if you haven't had a chance, you can go and fill that out when you can. But again, as I'm wrapping up this portion. So to infrastructural challenges, they suggested free and frequent shuttle options, more resources for those who are homebound, strive for consistency across different centers and spaces, and more resources and communication for site staff. Operational details, account for different needs, whether that's cultural, lingual, or physical mobility related. Utilize places that are already familiar to potential users with tailored activities. So this was a big one. People are more likely, as probably all of us, are more likely to seek places that we are already comfortable with. And again, more analog communication, person to person, sandwich boards, and then more access to seating and clean washrooms, and more hours, so extended hours into nighttime. And then concerns and perceptions. So here we have nothing. And this is why I said that this is a sticking point, and these kinds of things that require dialogue is exactly what we are going to address tomorrow in the face-to-face session in the knowledge exchange. So, all these other things we can report as a paper report. But I think there are things that require dialogue and, nuance and empathy and discussion. And that's what we're trying to do tomorrow. But overall, I also want to mention, I think there are important, meta level considerations to account for. So I think there's a question to be asked about reallocating resources so people can be cool where they live. So again, not dismissing or diminishing the importance of these cooling centers, warming centers, but realistically speaking, most people want to stay where they are, and many people have mobility challenges. So, things like utilizing common rooms and buildings as cooling rooms has been really effective. As Ms. Yang noted in that video, in that building, it's a multi-unit residential subsidized housing building in Chinatown, and they use the multi-purpose room as a cooling room. And as she said, people sleep there and people go down to charge their medical devices. And so these can be really effective. And also advancing tenant protections in meaningful ways. So accounting for, findings that said, I have AC, for example, but I can't use it because my landlord stops me, or because, it's just too expensive. So there are other ways to get at this, that's not just cooling centers. And that brings me to the second part of right to cool. So again, if you can fill out the Menti if you haven't already, I will get to that shortly. So good chance you've all heard about Right to Cool by now, but in case you haven't, so there's multiple initiatives under this banner across the country in many different shapes. So a prominent one is this push towards a max indoor temperature standard. Also rules for new builds, like a temperature controlled room. And then there's this whole other set that is more, current renter focused, couching this as a renter's right. And at this point, I would love to see what you have said for your idea of right to cool. So let me just go to Menti. Okay, so we see, BC Hydro air conditioning, never heard of it, never heard of it. Safer places, equitable access. Okay, yeah, so not many people have heard of it. Rights for individuals to be comfortable and safe. So yes, so here we see more of an individual rights approach. Dignity, great. Yeah, public approaches, human rights. So yeah, so we have a range here. So cooling centers. I see the word right a lot. Yeah. Diverse needs. Equity gaps, great. Equity gaps, great. So yeah, we have everything from, air conditioning to rights, to public spaces, to subsidies, public programs. Great. All of these are correct. I mean, all of these are happening. And that's kind of the point right now with the Right to Cool movement, that it is pretty wide ranging, which is exciting. There's a lot of hands on deck, which is exactly what we need. So back to my slides. Thank you for answering that. That's also very helpful for our event tomorrow. So you can also see here why, the wide-ranging answers make it really challenging to really pinpoint what exactly we need to do. So certainly it is not as simple as just temperature and humidity, and especially because there are scholars and advocates who have stated that air conditioning alone is not a panacea across the board. So, there's groups like TRAC, so that's Tenant Resource and Advisory Center in Vancouver, doing this work of thinking beyond temperature and humidity, max indoor temperature requirements, to broaden how we think about right to cooling. And again, this is not to say that air conditioning and max indoor temperatures are bad, but these are partial solutions to a much bigger problem. These solutions are not manifesting in a vacuum. This is happening in a world that is rife with inequities. So ultimately, different assumptions and different approaches lead to different solutions. So we need to zoom out a little bit to, you know, get a feel for where we're at and like how we can maximize synergy across all these different approaches. So here's one version of that zoomed out view. And we at the Center for Climate Justice at UBC, we're working on this. And I want to credit my colleagues here. So Dr. Rafi Arifin, Dr. Jerry Pratt, and also Katie McChesney for thank you for thinking through this with me. So we've grouped this under three broad buckets. So there's technological innovation, which leads to things like max indoor temperatures, standards, building engineering. So you see things like LEED certifications, air conditioning, heat pumps. A lot of these are individual behavior oriented, or, you know, a consumer approach where you buy a heat pump. And, you know, that has really driven up the price of heat pumps. And I mean, I'm not an economist, I can't really comment on this, but with more demand, obviously prices will go down, but also, go up. But this is an important solution. So there's challenges around that. And then there's the housing quality and security approach, which is about guaranteeing a functional cooling that tenants can control without risk of displacement or rent hikes. So, a big focus on tenant dignity. And then there's the health and well-being approach, which includes things like public health policy, public infrastructure, urban planning, and cooling centers that we just talked about, I think would fit under the health and well-being umbrella. A lot of these also, again, are individual behavior and choice oriented. This also includes social connections and wellness checks. And so, you know, overall, you can see here that there's overlap between all of this, but you can also see where the fault lines are. And, you know, these are three big buckets that have totally different views, totally different sets of solutions and actors, and also policy pathways. But actually, the right tool should work on all three of these fronts and possibly more. But all to say, you know, something that's going to work is not going to ignore any of these. It's going to be at the center, overlapping all of these. So to close here, to make this happen, we need social justice principles to keep these anchored in a space of transformation rather than just, you know, tinkering with the status quo. So what we do not want is just a mere tinkering with the status quo so that only fewer people die, but other fundamental inequities like housing precarity, inequitable access to resources, that, you know, this still persists, and also this mindset of health as an individual success fail endeavor rather than a communal pursuit. You know, if that stays intact, I don't think we've done much. So instead, I think what we should be asking is, how can a right to cool help us advance more justice and healthier, more equitable communities? And more specifically, how might a right to cool advance all three areas? So these are the three buckets that you just saw: housing quality, security, health and well-being, and technological innovation. And these are the questions that we're going to tackle together as a group tomorrow at the Knowledge Exchange. So yeah, your discussion, your questions here will be really helpful to inform that. Yeah, so I'll end here. Thank you very much.